So in supraventricular tachyarrhythmias, we are saying AVNRT, that is atrioventricular nodal reentrant tachycardia. So first we'll see the mechanism. So in normal people, we have fast pathway in the AV node. This is the AV node. So this is the fast pathway. Now this fast pathway is having a long refractory period. Now in some people, we have another pathway in addition to this fast pathway. That is the slow pathway. This is the slow pathway, which is having a shorter refractory period. Now, normally, when the normal impulse comes, it will go through the fast pathway to the ventricles. Now, when the impulse comes to the slow pathway, it is blocked here because it will take a lot of time to come till this point, and by the time it reaches this point, this fast pathway goes in the refractory period. So that is why this any impulse which comes to the slow pathway is blocked. Okay, so here it is blocked. So the impulse which is coming through the slow pathway, when it reaches this point, it is the fast pathway is in the refractory period, so this impulse is blocked. So in normal situation, everything is okay. Now the problem happens when the patient has a premature atrial contraction. So this is the fast pathway. This is the slow pathway. Now we have a premature atrial contraction. Premature atrial contraction. So when a PAC occurs, the fast pathway is in the refractory period. Okay, so refractory period is the interval between two normal impulses. So fast pathway is in the refractory period. So this PAC will travel through the slow pathway. Now by the time this PAC reaches this point, the fast pathway opens up. Now it is no longer in the refractory period. So what happens is this impulse will go anterograde direction also to the ventricles. That is the bundle of His Purkinje, as well as it will go in the retrograde direction through the fast pathway to the atria. So now this initiates the formation of a reentrant circuits. Reentrant circuit. So when it goes back to the atria, again it will enter this slow pathway. Again it will go anterograde to the ventricles. Again it will go retrograde to the atria, and this keeps on happening. So this is the reentry tachycardia. Now, this retrograde transmission to atria and this anterograde transmission to ventricles happens simultaneously. So that is why in the ECG is what you get is the QRS complex is your anterograde transmission to the ventricles, and the retrograde transmission, it creates an inverted P wave because it is retrograde transmission, which is actually buried within this QRS complex. So it is invisible. This is a typical AVNRT. There are some atypical AVNRTs also where the P wave occurs after QRS. This one is in a typical AVNRT. The anterograde transmission is through the slow pathway, which has a shorter refractory period, and the retrograde transmission is through the fast pathway, which is having a longer refractory period. And the P wave is inverted and it is buried under the QRS complex. So, what are the features? So, the rate is around 120 to 180 beats per minute. It is a tachycardia. Second is the RR intervals are regular. P waves are buried within QRS complexes. So P waves are present, but they are invisible, and the QRS complexes are narrow, as it is a supraventricular tachyarrhythmia.